Tough decisions will have to be made about major global events such as the Olympics if the coronavirus is unable to be contained. That's according to a top ESR virologist who says there is a long slog ahead in dealing with the deadly illness. Health officials today confirmed there are no new suspected or confirmed cases of coronavirus in New Zealand, but all foreigners who have left or travelled through China are banned from entering the country as a precaution. Dr. Erasmus Smit says it tends to be people with compromised immune systems who are succumbing to the virus, with their lungs eventually shutting down. But he told me healthy people are getting sick too.
There have been people who who didn't have underlying immune compromise or issues as far as one can tell. There wouldn't be any information in terms of smoking. It could be possible that that particular patient was a heavy smoker. One doesn't know. But there will definitely be a genetic predisposition for certain individuals to have more severe infections, whether you've got underlying health conditions or not. I haven't seen any reports yet to suggest that it's the same as with SARS. In SARS, there was a group of individuals, healthy individuals, who would develop an immune response, and then seemingly, as the viral load starts dropping, they actually get worse. And that was due more to an overreactive immune response to this massive amount of virus they had in their bodies. From the studies which have been published in patients in ITU and so on who've died, they've done some of these chemical markers called cytokines, and they haven't shown that this were particularly high in individuals who died. So I think at this stage we cannot say in terms of the pathogenesis for healthy individuals, would there be a specific people with specific genetic background who would be more at risk of dying.
There is talk of patient zero, right? Why is it so important to find that person?
To be honest with you, it's only important in the movies. I can't think why it's important to find that person. It's very interesting to find that person. As I said, that would be the person where the virus would have jumped from an intermediary or an amplified host to that person. It's possible that that person was immune compromised, and therefore the virus could replicate at a low level and therefore undergo mutations as it replicated. It's also possible that there were multiple introductions.
So what happens now? Do we just wait and wait for this thing to run its course and develop some kind of vaccine, or what happens? There's multiple fronts. So the first is obviously trying to contain the epidemic. So that would be, we talk about R0, in other words, trying to understand if you've got one infected person, how many more people do they infect? And currently, all the previous numbers suggested that one person would infect 2.6 other people. If you can reduce that number by 60%, you usually can let the epidemic burn out. And that's basically what happened with SARS. Once you have too many individuals to infected, it's going to be very hard to see that this is going to burn out, because especially in very populous populations. So have we passed the point of burnout?
Personally, I think we have. It would be remarkable if this is contained, but it remains to be seen. I mean, with SARS, I was also very skeptical that it is going to be contained, and it was. So from our point of view, it's possible. In terms of what else you can do is vaccines. That certainly is a possibility. And one of the remarkable things about this epidemic, apart from all the how quickly it's escalated and all the real-time information one has, it's been remarkable to see how science has come together in terms of helping with diagnostics, and how it's being applied now to also work on the vaccine front, and then also on the antiviral front. In terms of the vaccines, vaccines unfortunately takes a long time, not just to develop, because you first need animal studies, but then also to try it out in population. So vaccines probably quite far off, I would say. Maybe some early phase studies might start in a couple of months. The thing which one can push through very quickly, especially with the latest technology, is to develop antivirals.
So how long before we know if we're in the clear?
So the epidemiologist would be able to answer that question. It's not really my field of expertise, but one can look at the epidemic curve. Usually with an epidemic, you'll see a first wave, and it gets better, and it looks as though you managed to put the lid on the infection. But as I say, once it's spread into other countries, especially countries where you cannot monitor infections very well, and also the fact if you infect people asymptomatically, then what typically you see is a second epidemiological curve or wave which comes, and it's usually much bigger than the others. At the moment, we're lucky it's summer here, so respiratory viruses struggle in the sun. They prefer cold temperatures, not just for survival, but also people are congregated closer together. And also, there's no other respiratory viruses available or circulating much. We will struggle if we manage to contain the virus very well at this stage, and if at a later stage, say in winter, makes a comeback, because it's much harder controlling viruses in a winter.
So whereabouts are we in that phase curve then? And are things like the Olympics going to be at high risk times?
The best scenario would be as we've had with SARS, where you can identify all infected patients, isolate them, and make sure that they don't infect other patients. If not, and you get, say, a slow burn, so you get infections ticking over slowly, I think it's going to be hard choices to make in terms of the Olympics, because in my opinion, the way things are going, this is going to be a long slog, and it's not going to be over soon. So difficult decisions for a lot of people to make at this stage.
And that's Dr. Erasmus Smit, who is a ESR virologist.